HealthGap's 17th annual virtual Health Expo, featuring 90 minutes of healthy food and fitness demonstrations, entertainment, healthy lifestyle tips, and more. There's so many fun and healthy things for you to enjoy. So let's get started.
Hi, everybody. I'm Michelle Hopkins from Cincinnati Children's, and welcome to the Cincinnati Children's stage at the 17th annual Closing the Health Gap Health Expo. We are so glad that you could stop by and make a virtual visit. We hope that you are all staying healthy during these very challenging times. Now, at Cincinnati Children's, we want you to know that we are always working for the best health outcomes for children and families in our community. We also want you to know that we are committed to the community, and we're going to demonstrate that to you in many ways. So stick around, you'll see that on our stage. You're going to hear from some of our amazing doctors as they talk to you today about the COVID-19 vaccine, how COVID-19 can affect a child's mental and emotional health, and then what you can do about it. And then physical fitness is extremely important. One of our doctors is going to weigh in on that topic. Thanks for watching. I'm Michelle Hopkins, and enjoy. You might think it's simple. The vaccine comes out and you get it. But for many in the Black and brown community, it's not that simple.
But we're ready to take your calls, and we're ready to find out why is it so hard to get you to sign up for the COVID-19 vaccine.
Lincoln is walking the talk, rolling into a drive-through at UC Health.
Ready to get that vaccine? Getting ready to get it.
And within about 6 minutes, Lincoln is rolling up his sleeve to get the COVID-19 vaccine.
Relax your whole shoulder all the way down to the side. Perfect.
And just like that, he's done.
I am going to get the vaccine because I want to be safe. I have 2 children, I have a husband, and I have creative work to do. And I want to keep the community safe. And more importantly, I want to get my life back.
So yes, I will be taking the vaccine, and I encourage everyone to do so. I'm a firm believer that we are our brothers and sisters keeper. So we need each other to do your part. I need you to do your part as I do my part.
The statistics are daunting. Blacks and Latinos die at higher rates. When it comes to getting the vaccine, the numbers for Blacks and Latinos are extremely low so far, only about 5%. A few reasons: mistrust of the medical community and fear of the vaccine.
The vaccine is not the problem. The problem is COVID-19. It's not vaccine, it's COVID-19. If you don't deal with the vaccine, you might not be around because COVID-19 will take you out.
The reason I got vaccinated is because I want to make sure that I'm keeping myself safe, definitely keeping my family safe, my patients, but also our community.
That kind of trust is lacking for many in Black and brown communities. That's where messengers like Lincoln can make a difference.
I don't have any side effects. My arm is not sore or anything, no more than it would be for a flu shot. So I'm good to go, waiting on my second shot, and I hope more people will follow me. We got it done.
Please get your vaccine when it's your turn. Don't forget to mask up. Don't forget to wash your hands. And don't forget to practice social distancing.
So stay safe and keep up the fight against COVID-19 so we can get to 0 cases in our region and get back to some sense of normal. Remember, we are all in this together.
Hi, I'm Dr. Lori Crosby from Cincinnati Children's Hospital. A lot of people have been asking about COVID-19 vaccines in our children. What's the status? What should we be doing? What should we be thinking about? What we know is that right now there are no vaccines approved for children. However, we do suspect that by the beginning of the school year, there will be vaccines available for children ages 12 and older. So it is our job to get the information we need, to get educated, to learn about the vaccines so that we're ready when they become available. What that means is understanding that you can't get COVID from the vaccines. That means finding out more about the process and that they are safe and effective. And especially recent data suggests they're very safe and effective for our teens. In addition, we need to do our part to help others who don't have access or don't have information about the vaccines, to make sure that we lend a hand, we step up to act, and we get them the information that they need. Thank you very much and enjoy the event.
Hi, I'm Dr. Angela Scott, and I'm a psychologist at Cincinnati Children's Hospital. And throughout this crisis, I've actually worked with a lot of teens and just helping them to cope and manage the distress related to all of the changes and adjustments that we've had to make over the last year. And so I just wanted to provide some general recommendations of things that you can do at home to help with coping and to manage overall stress. One of the primary things you want to do is just frequent check-ins with your teen or your adolescent to make sure that they're coping okay with what's happening right now. This could be as little as 5 minutes where you just kind of check in and see how they're doing. And if you do find that your teen is struggling with coping, here are some general things that you can do to help with that. The first step is just making sure that sleep is on track. A lot of my teens, based on their schedules with, learning virtually and then kind of moving into an in-person environment or a blended learning environment, have had a lot of adjustments to their sleep schedules. And so just making sure that those sleep habits are very consistent is very good for that. Also making sure that your teen is engaging in at least 20 minutes of physical activity in a day. Things like exercising, going for a walk, nature hikes are all really good for mental health and overall coping. Making sure that your teen is engaging in some kind of relaxation as well. This could be meditation. Also, if you do any kind of prayer or mindfulness, is really great for coping. Things like having good time management. A lot of the stressors that teens are dealing with right now have to do with being able to get things turned in on time, especially if you're transitioning, going from a virtual learning environment to learning at home. Sometimes that time management can be something or a barrier that gets in the way. So just helping with scheduling and figuring things out with regard to organization. Other things are just learning to be flexible in our thinking and to use positive self-talk and to keep the outlook positive and hopeful. Things like taking a break from electronics when you need it, and then also seeking out emotional support. Our teens can also get really creative in the way that they're coping as well. So things like listening to music or creating music. A lot of my teens are getting engaged with artwork and journaling, sketching. All of these things are really great for ways to express emotion and to kind of find a positive outlet to put that distress. So these are just some general things that you can try. I highly recommend that you just kind of browse through some of those options and see what might work best for you. Thank you so much for listening and enjoy the event.
Hey everyone, my name is Ndidi Unaka. I am a pediatrician here at Cincinnati Children's, and I wanted to take just a couple of minutes to talk to you about the importance of exercise. So our brains really do need physical activity to stay psychologically healthy. If your child has stopped exercising, you may notice an increase in emotions, especially irritability. Children and adolescents who are used to being physically active have brains that are used to that activity. Their brains need physical activity to stay psychologically healthy. Also, our brains work best when they have regular physical exercise. Concentration and focus right now have been really challenging for students who are engaging in alternative learning while school is physically out. Moderate exercise for at least 20 minutes has been shown to increase the ability to focus and learn in the hours after we do it. So we should take full advantage. Finally, exercise is really important for our sleep habits and hygiene. We need our children to sleep well, and normally during these times, our schedules are off. People are stressed. This is harder to manage when we are sleep deprived. Our coping skills are not as sharp. Exercise helps with both sleep initiation and consolidation. So falling asleep and staying asleep. So I hope you're able to incorporate these few pointers related to exercise into your daily activities and to the activities of your children and adolescents. And thank you for spending some time with us today.
What's up, good people? How you doing? It's your boy, Body by Rico here. Rico Epps coming to you all with a great workout that you can do in the privacy of your own home. NASM certified personal trainer, NGA, bodybuilder now. So the first thing we're gonna go as far as to do before I do every warm up is we're gonna do a static stretch that's gonna get us warmed up and ready for our workout. Let's get body. All right, now we warmed up, we stretched. Let's get into the workout. First thing we're gonna do is a series of squats. We're gonna squat down we're gonna go with the right foot first, and we're gonna go out 3 times, okay? So we're going 1, 2, and 3, and come back to the center, okay? We're gonna do that a series of 10 times. And here we go. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Good job. And we're going to the other leg now. 1, 2, 3. Every time, take that leg on out. 1, 2, 3. On the left leg, here we go again. And 1, 2, 3. 1, 2, and 3. Come on, stay with me now. I know it's getting hard. Stay with me. 1, 2, and 3. Good job. We warmed up doing some lunges as far as our stretch. Now we're gonna do it again, okay? So we're gonna go back to front. Right leg first. 1, 1, 1, 1, 1, 1. We wanna push off that foot, going back and forth. 1, 2. Good, there you go. Now we're gonna go to the left leg, do the same thing. 3, 2, 1, here we go. Keep that core tight. Keep our chest up, our shoulders back. Lunge into it, lunge behind. Good work, keep pushing yourself. Have a 90-degree angle, try to work on getting that front leg 90 degrees to the floor. 2 more. Good job, okay? So we're gonna do star jumps. We're gonna start out, coming here, back and forth. For those that can't do star jumps, we're gonna modify it, okay? Go out, side to side. Good job, those modified. On our toes. Good work, good job, good work, keep pushing. And done, good job, good work. Love working on the legs. I think the legs is an awesome part of the body to work. Work the muscular part of the legs, get those legs nice and tight. 1, 2, 3, put it all together. 1, 2, 3. 1, 2, 3. Last time going through. 1, 2, 3. Other leg now. 1, 2, 3. Again. 1, 2, 3. Now this time, we're feeling a little worse as far as our legs are a little tight. We're gonna just take it down for a stretch in the middle. So take it down, take your feet all the way down, touch your toes. Good work, good job. Now, we're gonna walk this out now, okay? We're gonna walk it out, 2 in the front. Good stretch for us. Right knee down, left knee up. And switch it. Do each one of these for about 20 seconds apiece so that you can go ahead and get your nice little stretch as we work these legs out a little bit. And here. All right, it's here, okay? We're gonna work on some arms, getting our arms nice and big, work on the little bicep, work on the upper body chest. Now, if you can do push-ups, go ahead and do push-ups, all right? But if you can't, Let's go ahead and do modified version, all right? So first, we're gonna start with the modified version. I'm gonna show you from a side angle. Go ahead and put your knees on the ground. Hands right here in front. Knees up. And we're gonna go down to the ground, push-ups. Okay? We're gonna do 10 of these, okay? If you can, from a somewhat experienced level, go ahead, go down to the ground, pop up off your knees, okay? We're gonna do 10 of those. So go down, pop up off your knees, and come up. If you're experienced, hey, let's go all the way down, feet up, good push-up position, and we're going down, all right? So try each one of the 3 of those for these push-ups, all right? Let's go, 15 push-ups. Here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, good job. So that was 3 sets of push-ups, 3 different ways that you can do in your privacy of your own home, just so that you can go ahead and get a workout in on working on your arms, your biceps, and your triceps. All right? Now what we're gonna do is we're gonna go up a little bit. We know a lot of like women's summertime, and when sundresses are coming out, we wanna wear some of those straps. We're gonna work on our shoulders now, okay? So, we'll have our hands all the way up in the air, feet up, going down, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good job. Way to work, way to work. Continue doing the workouts, continue staying fit, continue doing the things that you want to be able to do to help yourself getting better to a better lifestyle, a healthier lifestyle. This is your boy, Body by Rico. I'm out. Have a Get Body day.
Hi, I'm Anthony Jordan of Invito Personal Chef. I'm here today at the request and the blessing of closing the health gap. We're here today to put together a nice seasonal salad, something easy, something refreshing, and something nutritional. So I'm going to demonstrate the salad at this time. Today, we're using what we call a mesclun mix. A mesclun mix, sometime in the health circles, they call it power greens. And usually what we're going to do is just going to take the power greens and we're going to arrange them here on the plate as so, in abundance. And again, it's a summer salad, something light, something fresh, something quick. You can entertain friends and family, or just after a quick hard workout or run, boom. You got a good lettuce base, a veggie base, and we're gonna add fruit to it. Shrimp, we have candy walnuts and blue cheese, some of my favorite. And we also have mango and a mandarin. We're gonna take the mandarin and we're just gonna cut it down the middle. Cut some nice pieces, get some slices out of there, and wow, we're gonna have a great salad. Sit that there. Mango, also famously known and favorably known as a papaya. Gonna slice that there. We got a little bit of the core. I'm gonna get that out of there. We're gonna just sit this to the side for a second and come back. Let's get one more slice. We wanna just bulk this salad up here. It's very important to have a sharp knife. You got the salad here. What I like to do is I like to take the dressing and dress the actual lettuce first, lightly, and today we have an apple thyme vinaigrette. The reason I like using vinaigrettes, vinegar has what they call polyphenols. The polyphenols have a chance to detox. Kind of detox is good with helping lose weight, and it's been known to help with diabetes and control blood sugar levels. So we're just going to kind of shake this up, make sure it's all mixed, nothing separated, and just lightly. We don't have to drown it. We're looking more for taste. Just so. We're going to take grapes. Just kind of arrange them instead of plopping them on there. We got the candy walnuts here. And my favorite, a little blue cheese. And then the icing on the cake. These are ginger garlic shrimp. Sauteed in a little olive oil. Seasoned, of course, with ginger and garlic. I'm just going to kind of put those there. And we're going to take this here, turn the plate around so you can see. We're just going to garnish it. We're going to turn a $5 plate into a $15 salad. Mandarin oranges here. Boom. Nice, beautiful summer salad. Easy to make, easy to eat. Anthony Jordan of InvitoPersonalChef.com. 513-746-8233, or you can find me on Facebook, IPC/BIZ, Facebook.com.
Wait, hey! All right. You guys ready to work it out? All right. We are called Way to Faith. My name is Phyllis, and on my right here I have Lila Sawyer. She's a boxing trainer. She's a personal trainer. Here on my left, I have Jeff Shelby, and he's a workout party. We are Way to Faith. What we believe is a little bit of weight will lift that faith. And when you have faith, faith works. All right, we're gonna do a free movement workout class today, freestyle. What that means is we're gonna make it up as we go. And we expect you to work out with us. If you haven't worked out in a long time, please take it easy. If you start feeling dizzy or sick anytime doing this workout, please let someone know. All right, y'all, we're gonna take it here. And we're gonna go to a march on the right. Here we go, and march. And we're just gonna have fun. How you doing? Yeah. Work at your own pace. 4, 3, 2, step it wide to the right and step it. Good. 4, 3, 2, run it in place, bring it in. Take it wide, keep it going. Good. We're warming up, believe it or not. Yeah, we are. We're gonna take it to a squat in 4. 4, 3, 2, and squat. 1, 2, and breathe. 3, 4, 4 more. 5, 6, 7. Hold it down on 8, 8, 7, 6, 5, 4, 3, 2. Add some shoulders right here. Good. 4, 3, 2. Double it here with the shoulders. Yeah. How you doing? Woo! I'm loving it. Feeling good? Yeah. Put your own thing into it. March it up and march. Good. How you feeling? I see you. 4, 3, 2. Pump those arms. Good. We're gonna use the arms today, so you wanna warm them up, take them out to the side, bring them in. Good. Take those arms straight up. You're looking good. Take a march, take a march. All right. We're working. How you feeling? We see ya.
Good.
All right. We're going 2 times over to the left, 2 times over to the right. Here we go. And work it. Woo! You're doing it. How y'all doing out there? 1, 2, 3. Make it single. Woo, I know I'm having fun. What about you? 4, 3, 2. Bring it in and march it. Real cool. Woo. I know I'm feeling good. Yeah. We're gonna also do some leg work. 3, 2, and march. 4, 3, 2. Bring it up. We're gonna do a front kick. We're gonna start with the right leg, then the left. 3, 2, right leg, here we go. 1, 2. Large muscle groups, hips, thighs, and buttocks. The more you work them, the more fat you're gonna burn. You believe it? Yeah. Mm-hmm. You're working, good job. All right, y'all. Take that leg out to the side. Here we go. Good. You're working. Woo! Y'all look good out there.
Oh, yeah.
March it up. All right, at this time, we're gonna give Lila an opportunity to work it out. All right, go Lila.
Hey everybody, now it's time to grab that broomstick, to grab a weighted bar if you have one, or even if you don't have anything at all. I want you to take it to a march. Left and right, don't lift those feet off the floor. Hands on the bar, shoulder width apart. We're gonna do a reverse bicep curl into an overhead press, back to the shoulder, and down. Here we go. 1, 2, come on. 3, 4. You can do this without anything
5,
at all.
6, 7.
Good job.
8.
Come on, count it down.
8. 7.
Come on.
6.
Good form.
5.
4 more.
4. You're working. 3.
2 more.
2. And 1.
Good job. Step to the side, side to side. Keep those hands on that bar about shoulder width apart, or your hands in front of you. Shoulder width apart. Take that foot one behind the other.
Yes.
Take it to the next level. Add a hop right here.
This is my favorite.
We're gonna take it one more level, and we're gonna tap that bar down to the floor on each side. We're gonna show you right here. Here we go. And 1, 2, chest high. Okay.
Woo, keep the
4,
head
head
up.
up. 6,
I love
7,
it.
count down. right here. Work at your own pace.
Yeah.
All right, we want to show you one more. This time I want you to take that bar, turn it to my left side. It'll be your right. Hands still about shoulder width apart. We're gonna take that right foot. We're gonna lunge out. It'll be your left. And we're gonna bring that bar right across the middle of the body. As you stand, bring it right back up. You don't have to go deep. All you gotta do is move. Here we go. In 4, 3, 2, and 1. And 1, 2. You're working. 3. How's it feel? 4. 5. Come on, 3 more. 6. 2 more. We're gonna switch to the other side. In 4, 3, 2. Here we go. 1, 2. Excellent. 3. Don't stop. 4. 4 more. You're almost there. 6. Good job. 7. 8. Good job, everybody. Thank you very much. Woo. We're gonna bring Phyllis back out, and I'm glad you had a good time today. At this time, we're gonna go ahead, Jeff Shelby. He's gonna take it away. Woo.
All right. How's everybody doing out there?
Great.
Jeff Shelby, the workout party. You remember me? All right. All right, we're just gonna start off with a little groove. Workout party is all about, it's all about party.
Go, Jeff.
Before you know it, you work it out.
Yeah.
All right. Ready? 1, 2, 3. 2 over. 1, 2.
Oh.
1, 2.
See what I'm talking about?
1. Oh, yeah. All right. Just have fun with it.
Yeah.
All right.
We can see you out there. You're working. Keep going.
March it off. All right. Let's do some 4 corners. Take it out.
All right. Woo! Now I know y'all know how to do that.
Out. Yeah. 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 Come on, old school out there. I know you know about this.
You all looking good out there. They're rocking.
All right. All right. March it off. All right. Work that waistline out there. Side. Side.
Oh, yeah,
Arms
we
up.
always want to
2.
work our waist.
Yes. 3. 4.
Keep those abs nice
5.
and tight.
6.
Like
Oh,
the
yeah.
end of the knee.
7. 8. 4 times over. Here we go. 1, 2, 3, 4.
Woo! That's your Jeff. I know.
8.
Yeah,
You're gonna
Jeff.
feel it right on this, right
the
here. You
zone
should
now.
feel it right here. 2 times. Okay.
Woo! I love it.
All right.
You're working.
Single it up. Single it up. Go. Yeah. 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 Yeah.
Put your body in
Yeah.
it.
Yeah. All right.
You can add a squat to it.
I know you're feeling it out there.
Yeah, we are.
Watch it out. All right. Now we're going to work out the shins and we're going to work out the calves. Do a little bit of work with the knees. Feet together. Bring them toes up. Bring it up. Up. 2, 3,
Abs
4,
are tight.
5, 6, 7. Bring it up on your toes. 1, 2, 3, 4, 5, 6. Let's do some low drops, low drops, low drops.
Oh, yeah.
All right.
Freestyle.
All right, kick it out, kick it out, kick it out. We're gonna do that one more time. Take it out a little bit more. One more time, toes up. 1, 2, 3, 4, 5, 6, 7. Bring it up. 1, 2, 3, 4, 5, 6, 7. Low drops again.
See how cool he's doing it? All right.
Yeah.
Work it out,
Kick
brother.
it out, kick it out.
I see him doing it out there.
Uh-huh.
Right.
Take it side to side, side, side.
Working that
side,
waist.
Side, 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 side. All right. All right. 2 times over. 1, 2, 1,
Oh,
2,
okay.
1, 2, 1, 2.
Now you're working.
All right. All right. Hope you got a good workout
y'all.
for me. Yeah.
This is how we do it.
Yeah.
At Way to Faith, it's freestyle. We don't teach the whole class. We bring you guys up to teach. So if you're at home in your living room, pick somebody to teach right now. Give yourselves a hand. Good job, Way to Faith. You can reach us at 513-518-8225. My name is Phyllis Davis. You can also go to our website, waytofaith.com. We love you guys. Keep working, be healthy, and have faith to lift the weight. Thank you.
Hello, I'm Greg Kesterman, Hamilton County Health Commissioner. Hamilton County Public Health has proudly served our community for over 100 years. Over the last year, COVID-19 has changed the way we provide services, but we remain committed to preventing disease, promoting health, and protecting our community. In addition to our regular services, Hamilton County Public Health is focused on fighting COVID-19 through education and our vaccination efforts. If you haven't gotten vaccinated, there are a lot of opportunities to do so in Hamilton County. Visit hcph.org/COVID-19 for more information on how and where to get your vaccine. We're fortunate to have a team that is dedicated to the health and safety of our citizens of Hamilton County during these trying times and want to take this opportunity to highlight some of the work that we do day to day. Thank you very much.
Maybe the term public health makes you think of restaurant inspections or flu shots. Maybe you think of the health department as the place you go to get a copy of your birth certificate. But Hamilton County Public Health is much more. We provide a wide range of services for residents, communities, and businesses. We'll start with epidemiology, the backbone of public health. As Hamilton County Health Department, our team of epidemiologists monitors the health of our community. They collect, analyze, and report data on things like deaths and births, infectious diseases, overdoses, and injuries, all to identify potential threats to the health of our community. Epidemiology gives us the data we need to develop, implement, and evaluate the effectiveness of programs to prevent disease and promote health for everyone in Hamilton County. Every day, our disease prevention staff works to prevent and control the spread of diseases that can be devastating to you, your loved ones, and the health of our community. This means free HIV testing, linkage to care, and notifying partners of potential exposure. We also offer free testing for other sexually transmitted infections and monitor new cases to prevent the spread of diseases. We provide tuberculosis testing, and our trained staff works with those who were diagnosed with TB to ensure that medication required to prevent the spread of the disease is taken. To decrease the harmful effects of drug use, Hamilton County Public Health is meeting people where they are.
The van goes to multiple locations throughout the county. It's a needle exchange, a syringe exchange. It's a one-for-one exchange to get dirty needles out of our community and disposed of and removed properly for all of our safety. I have not met clients in this position with a substance use disorder that are satisfied with the quality of their life or the way that they try to manage day-to-day living. But when we are offering assistance like the van, like Connection to Treatment, I think it helps the community in a bigger role because it lessens the exposure and the risk that we may have to those diseases like Hep C and HIV if we're providing services to connect people to treatment for those.
A young lady was outside and she came up and put her hand on my shoulder and said, "Hey, can I get some help?" And we said, "Absolutely." So we got her in on our truck, did services for her, and then got her to the point that we got her into treatment and then have followed her through that process. It's very gratifying knowing that we've helped one more person on the street here.
In 2018, we collected nearly 400,000 used syringes, and that alone provided high levels of safety and wellness for all of us in the community.
A healthy and safe Hamilton County also relies on things that we now take for granted, like proper waste disposal, clean water, and safe food. That's why our environmental health services are so important to the overall health of our community. You may not give much thought to what's going on underneath the ground, but we do. The county's vast sewer system was developed to take waste and stormwater out of the streets and away from our homes. Early on, Hamilton County Public Health recognized the need for plumbing regulation to ensure clean drinking water and appropriate disposal of waste. Today, our certified plumbing inspectors work with residents and contractors to ensure the safety of our water supply. As rural areas of Hamilton County were developed into residential communities where the sewer system did not reach, individual sewage treatment systems or septic systems were installed. This was a good solution at the time, but these septic systems have to be maintained. Today, our staff completes annual inspections to ensure that homeowners are properly maintaining their septic systems. Incidentally, the inspection program began with a citizen-driven initiative to work in the western part of the county to eliminate faulty septic systems causing pollution in streams and yards in the area. This citizen-led initiative ultimately led to one of its leaders being named to the Hamilton County Board of Health. At one time, nearly every community in Hamilton County had their own town dump, with little oversight or regulations. In some cases, this led to contamination of ground and surface water and the release of harmful gases from the waste, not to mention the potential spread of diseases. Today, most waste in Hamilton County goes to the Rumpke Sanitary Landfill. Hamilton County Public Health inspects and monitors the landfill and other solid waste disposal facilities. Hamilton County Public Health has always been considered a leader in food safety. Some of the first regulations adopted by the Board of Health were intended to protect the county's milk supply and food trucks. In 1963, Hamilton County received the Crumbine Award, a designation given to the best food safety programs in North America. We received the Crumbine Award again in 2013. While all health departments are required to follow state food safety rules, we take this a step further with our food safety education programs for restaurants and schools. Our efforts to educate and work with licensed food operators is unique to Hamilton County Public Health.
In December of 2018, in the middle of my holiday baking, there was a knock on my door, and I went to the door with my apron on in the middle of baking and opened the door to two men in brown uniforms who identified themselves as health inspectors from the Hamilton County Health Department, and my heart dropped to my toes. I thought, oh my gosh, they're here to shut me down. You know, and we were in a period of, we needed every single dollar that was coming in from those pies to keep food on the table. So what they said was, we don't want to shut you down. We want to help you do this the right way so that you can be successful.
Hamilton County Public Health's Clean Kitchen Award is given to restaurants and schools that do the most to provide a safe dining experience. Winners are recognized by the Board of Health and given a certificate that they can proudly display at their business. At Hamilton County Public Health, we understand that where you live impacts your health, safety, and well-being. This was the case with Valley Homes in Lincoln Heights.
One day, I was tutoring, and I thought, before I parked, let me go through the Valley Homes parking lot and just reminisce, because I grew up in the Valley Homes and many of my family members. And as I went down the parking lot, I was in shock. I saw some of the buildings had holes in them, the doors hanging off. I was horrified. I started crying and said, hey, we got to do something.
We worked with the community to protect residents from these unsafe and unhealthy housing conditions. Valley Homes went on to be redeveloped. What once posed a risk to people's health is now a much-needed, affordable, safe, and healthy housing community.
I'm grateful to the health department for doing that, and you know, from there the relationship grew to the Village of Lincoln Heights becoming one of the first three communities to get involved with We Thrive, and we've been thriving ever since.
Housing is important, but one of the most crucial indicators of the overall health and well-being of a community is infant mortality. The Fetal and Infant Mortality Review, or FEMR program, examines social, economic, cultural, safety, and health system factors that are associated with fetal and infant death. Interviewing moms and families of babies who die before age 1 provides important information on the root causes of infant mortality. The FEMR program also helps facilitate the grieving process for families and connects them to support agencies.
I will go to the mom's home if that's what she wants, or we will meet somewhere out in public and we will conduct an interview.
It's a very emotional moment for the mother as well as the interviewer. We really take it as an honor to be able to extend our services to them here in Hamilton County.
We gather the information and we bring it back and we have a team meeting. And in the team, we'll discuss the case, we'll talk about the strengths, the weaknesses, some common threads between the cases, and we're trying to gather the data to see if we can make a difference in the infant mortality rate here in Hamilton County.
As you can see, public health is a part of your day-to-day life, but we're there in case of emergencies as well. Hamilton County Public Health serves as a leader in the response to public health emergencies. We will provide medication or vaccinations to populations exposed to pandemic flu, anthrax release, other biological releases, or infectious disease outbreaks. When needed, we open point of dispensing or pod sites across the county in order to provide medications or vaccinations in an organized way. Near the beginning of this video, we told you how data from our team of epidemiologists helps us decide where to focus our efforts. Our health educators share that data with communities in Hamilton County and helps people like you take action to make healthier living easier. Making healthy living easier for all residents of Hamilton County is what the We Thrive initiative is all about. What started with 50 people in 3 communities in 2009 now impacts more than 270,000 people throughout 25 communities. And We Thrive is still growing. Working with our health educators, We Thrive communities look for ways to improve the health and safety of their community. Teams of residents and community leaders choose one or more pathways to focus on, like substance abuse, social health, injury prevention, environmental health, emergency preparedness, and chronic disease. We Thrive also works with schools and child care providers because our children deserve a healthier start in life. In 2017, We Thrive was recognized as a model practice by the National Association of County and City Health Officials. The award honors programs that show how health departments and community partners can effectively collaborate to address public health challenges. Thanks for joining us in celebrating the 100th anniversary of Hamilton County Public Health. We hope you've enjoyed this look at how public health makes a difference in your life every day. As we look to another century of serving, educating, and protecting our community, we're committed to excellence. Our Board of Health invests in the development of staff through a workforce development plan and training for all staff on the principles of continuous quality improvement and performance management. In 2017, we became the first health district in Southwestern Ohio to achieve accreditation from the National Public Health Accreditation Board. As we work to maintain the level of excellence required to earn this accreditation, we're constantly looking for ways to improve the services we provide so that we can continue to positively impact your health and your quality of life. We invite you to keep up with the things we're doing to make a difference in Hamilton County by visiting our website and following us on social media.
How everybody doing? My name is Cootie Brown, the proprietor of Brown's Corner Health and Fitness Boxing Cardio. And to my left is Kendra Pugh, and to my right is Mahershala Woods. These are the girls that's going to be showing you how they do what you can do with bands. These are not regular bands, these are weighted bands. So we're going to get the routine started. You can do it in your home and buy you some bands and see what we do, or you can come to a personal trainer such as myself. I'm on Facebook as Cootie Brown if you need a little bit more push. Y'all ready? They're going up and down. They're going to do the up and down. It hits everything. 15. Hit your arms, your shoulders, and also hit your thighs. As you see how the ladies go down, you see where it hits at? That's where it hits at, right in here. Hit your thighs, your arms, and it works your shoulders. Now they curl, and what it does, it's hitting their arms. And one thing I enjoy about the bands for ladies is that they won't be bulk. It'll just get them in shape. It'll tone them. That's why we use the bands with them. The next routine ain't gonna be doing this for your shoulders. All you do is just go up and down like this. Hit your shoulders real good. Knock it down, 3 sets, 15. Knock it down, ladies. There y'all go, push it. Try to get them up a little higher. There you go. We're gonna switch over to the kettlebells now. Give you some demonstration of the kettlebells and what the kettlebells does for you as well. Knock it down, ladies, come on. Drop it, come on. 15, just get it up, go. Kettlebell is great. What I really enjoy about the kettlebell people is that it gives you cardio as well as a great workout. And they doing the same thing, but what it is, this is different. Give them a little bit more weight. We toned them, now we're giving them some weight so they can have a nice curve. So we just kind of mixing the two. These are exercises you can do at home if you get the right equipment. But like I tell everybody, that if you need a little push, that's when you come to a personal trainer or you go to a gym. Push it, go. And we do these as 1-1. These are, you count them 1-1. Each side, 1-1. Keep pushing, keep pushing. Knock that work down, there y'all go. Knock it down. Keep working it, babes. Y'all got this. Keep pushing. See how it's hitting the legs and everything. If you bring your arm up, as Mahershala is doing, bringing the arm up as well, it's helping the shoulders still too. Keep pushing. There y'all go. 15. Watch the breathing. There y'all go. Keep pushing. Keep pushing. There you go. Good kettlebell work. Good work, ladies. Good work. Keep pushing. Keep pushing. You got to work at this. Real work, real results. The next demonstration we're going to do for the stomach. Stand up straight and they just lift it up and it pulls your torso and everything. There you go. There you go. Brown's Corner Health and Fitness. We're located in Price Hill, and you can always research me on Facebook under Cootie Brown. Or you can hit Kendra Pugh or Mahershala Woods. We're a team, baby, and this is what we're about, getting you healthy, getting your body right, and also getting your mind right. Remember, working out is 90% mental and 10% physical. You can do it. We just need your body. Thank you.
Hello everybody, it's Markeisha from Redefine Studios. I'm here today to do some dance fitness. I hope you guys are ready because we're gonna kill it today. Start side to side. Feet drop. This way first. Keep going. Come on. Knees to the front. Pull them back. Come on. Hit, 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 hit. Come on. Back to the front. Knees to the front. Keep going. Pull them back. Keep going. To the front. Woo. Keep going. Woo. To the beginning. Knees. Now that we done worked out, it's time to cool down. This time, we're gonna do all arms. The only rule I have, do not drop those arms. Keep them up, okay? In and out, up and down. Come on. Keep going. Woo. Keep going. Huh. Keep going. In and out. Let's get it. Woo. Don't give up. Our arms, don't drop them. And the legs. Woo. Thank y'all so much for working out with me. I know y'all tired, because I'm tired. I got a good workout in. I hope you did too. If you want to follow me, go ahead and follow me on Instagram, Hip Hop Redefined or Redefine Studios. We're also on Facebook, and we have a website, hiphopredefine.com.
Hey everybody, it's your girl Morgan Angelique Owens, and I am the founder, owner of Curvy Cardio, which is 8 years old. Curvy Cardio is all about empowering women and young girls to love themselves from the inside out through fitness. Now, during Curvy Cardio, we are such a tight-knit community of women and men that join us that support each other in our wellness journeys. For me, I've struggled with weight all my life, and that's why Curvy Cardio was formed as a way to do something about it and not just sit and complain. Now, back then, yes, I was the only one that was going to the gym, working out, but since then, I have built up such a great tribe with Curvy Cardio and others to help with my fitness journey. And so I just want to talk about just ways to stay encouraged through your fitness journey. The most important thing is you have to do it for you. A lot of people will try to tell you otherwise, to do it for them, do it for other reasons, but when it comes down to it, you have to be your own motivation. You have to be that one that wants to go out and get it. And that's for everything in life. So fitness shouldn't be the only thing, right? And so the next thing is you have to build up changes. You have to build up changes in your lifestyle. You have to swap out all those good foods that are so bad for us and start incorporating healthier foods. So if you like pop, which I do too, I like a nice cold Coke every now and then, but learn how to swap out a Coke for a water. Learn how to swap out that juice for more water. Water, water, water. Hydrate. It's getting warmer out. You have to get your water intake in. The more water you drink, the better it is from your body, from the inside out. Another important tip when it comes to working out and with Curvy Cardio is that we always tell people to go at your own pace. So yes, you're gonna have a lot of these workouts, a lot of different instructors, but you have to go at your own pace. And as always, consult with a doctor if you're starting a new program, because we wanna make sure that whatever the workout is, it's gonna be healthy and happy for you, right? Because we don't want any complications. So go at your own pace. If you have a bad knee, ask the instructor to modify, do what it is that you need to do to stay healthy and happy. The next thing is, and I think it's the biggest thing, is to have fun. Have fun with your workout. Try multiple workout activities. Try Curvy Cardio. Maybe it's not your cup of tea. Try running, try kickboxing, swimming. There are so many things that you can do to stay active and to get into shape, but make sure that you're having fun, because if it's not fun, you're not gonna do it. And the best thing about Curvy Cardio is we always have fun. Like I said, we always go at our own pace. We always try to be upbeat, positive. We always try to be inclusive of everyone and their needs. And so I wish you guys would check out Curvy Cardio, enjoy the workout, do it with us, be healthy, be happy, and above everything else, have fun.
I'm Michelle Sneed with Fit Life Training Center. I'm a personal trainer and fitness instructor. I teach Silver Sneakers, and I also do a lot of private training and boot camps for We Thrive Forest Park. So today we're going to do a full body workout. We're going to just go through it one time, but this is something that you can do 2 to 3 times. So we're going to start out with a warm-up, a little dynamic stretching, just to get our body and our muscles warmed up. Just doing a little back and forth with the arms, chain breakers. So we're stretching the chest and stretching out your back muscles. The shoulder rolls to the back. So with warm-ups, you want to definitely get your body warmed up first before you do any static holding stretches. Roll the shoulders forward. All right, we're going to stretch it up, reaching up and overhead. So we're stretching out the obliques. Reach them up for a few. Perfect. We're gonna side to side. You can place your hands either at your side or at your hips. Loosening up the hips. Bring them in. So we do a high knee march here. Stretching out as much as we can. Warming up the body as much as we can. We're gonna go through 4 different pods consisting of different exercises. First pod that's gonna be coming up, pull those heels to the back. It's gonna be 1 exercise in that pod. It'll be jumping jacks. All right, we ready? Go ahead with those jumping jacks. Pod number 1, 25. Counting down, 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. And it's gonna work our core. So starting up for those, starting out with standing, reaching toe touch. 20 per leg. That's 5, 6, 7, reach for those toes. 8, 9, 10, halfway there. 10, 9, 8, 7, 6, 5, 4, 3, 2, then 1. Minimal rest in between. Working those obliques. Once again, standing. Let's go. 2, 3, 4, 5, 6. Turn that knee out. 8, 9, 10. 10 more. 6, 5, 4, 3, 2, 1. Go right into the other side. Turn that knee out. 6, 7, 8, 9, 10. Halfway there. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Second pod's done. Get a drink of water. Catch my breath. Going to the weights. Everyone ready? All right. Starting with the one-legged deadlift. So we're gonna do these in a different way. Offset your feet, hinging in the hips, stretch down, cut back up. That's 15, starting now. Keep the shoulders back. 6, 7, 8, 9, 10. 5 more. 5, 4, 3, 2, and And then 1, go right into the other side. Hinge forward, squeeze up. That's 6, 7, 8, 9, 10, 5 to go. And 4, and 3, 2, 1. Second exercise in this pod, tricep kickbacks. Minimum rest in between these exercises. That's 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, and that's 15. So I'm gonna go down to 1 weight. Once again, minimum rest in between, stepping out, side lunge. 15 per side. That's 2, 3, 4, 5. Press that heel back towards the bum and squeeze up. 7, 8, 9, 10. 5 to go. 5, and 4, 3, 2, 1. Go right into the other side. 1, 2. Let me get a little closer. 3, 4, 5, 6, 7, 8, 9, 10, 5 more, 5, 4, 3, 2, last one, perfect. End of pod 3. At this time, take another break. Catch your air, keep breathing, breathe, breathe. Little sweat. Never hurt anybody. Get yourself a drink of water. Hydration is key. Fourth and final pod. 4 exercises, 10 reps, minimum rest between the 2. Starting with the first one is a dumbbell thrust. Grab hold of your weights. They're gonna start on your shoulders. Take your legs out, about hip width apart. You're gonna sit back in that squat, drive up. 10, 9, 8, 7, 6, 5, 4, nice power moves. 3, 2, and then that's 1. Keep those dumbbells, don't go far. Rows, single, single, double, okay? That's single, single, double. That's 2, 3, keep that neck in neutral to the spine. 5, and 6, 7, breathe, 8, exhaling out. That's 9, 1 more, and squeeze. Perfect. Next exercise, we're stepping back. Minimum rest. Step back in that lunge, curl it up. Step back. Nice combo moves. Whew. That's 3. I'm sorry, 2. Counting per leg. Step back. Exhaling. Lift. Let curl. Heart rate is up. I'm feeling warm, feeling great. Halfway there. Good. Take your time. Try not to rush it. Y'all keeping count with me? Good. We're gonna do 3 more. Exhale. Lift. Lift. 2. Lift. Last one. Lift. And back. Curl. Perfect. I'm gonna place these out of the way. 4th and final exercise. If you have a band, that would be great. I'm gonna take that band behind the back, to the front, chest press. Let's go. That's 1, 2, 3. Squeeze to the front. 4, 5, 6, 7, 8, 9, and then 10. Perfect. So that's the end of pod number 4. And if we were doing this in my regular boot camp class or under training, we would go through it 2 to 3 more times. So that's your option. You can go ahead and replay this whole workout, starting with pod 1, consisting of jumping jacks or something cardio, 25. Second pod was your core. So we were doing the standing toe touches. You can do crunches. We were also doing oblique crunches. That was 20 each. Drop down to the third pod, the 3 exercises consisting of one-legged deadlifts, tricep kickbacks, and side lunges, 15 reps each. And the 4th pod was, of course, dumbbell thrusters. We had the rows, which you can end up upping to a renegade row. And we had the step back lunge with the bicep curl and the chest press, each with 10 reps. So let's go ahead and cool down a little bit. Let's do some stretching. This is where we do our holding stretches. So roll those shoulders back. Kind of started with these, but they're really great at the end for those shoulders, for those thrusters, depending on the weight of your weights. Hopefully you want a little heavy. It's a nice little challenge. You got the heart rate up. Mine is up. Go ahead and grab those arms to the front, stretch. Nice little pull and stretch to the front. Great. Take those arms out to the side. Palms are up. Lift the chest, lift the chin, pull back slightly. Stretching within the chest. Drop the arms down into the back. Nice little pull. And at this one, tilt your head to the side. Stretch there. And then change your top pull and stretch to the other side. I hope you had fun with me today, sweating. And bring it up, hands on the hips, hip circles. I had fun. I enjoy working out. Kind of helps relieve stress. Around, around. Good. Take the legs out a little bit further. We're gonna stretch over to the side, one way. We're gonna drop that down towards the front. Stretching towards the toes. And walk it around to the other side, roll around to the other side. There we go. Up and over. All right, sit it down, push it back. Roll the shoulders forward, arch that back, roll it up, and then sit it down again. Sit back, arch to the back, roll it up, One more time, sit it down. Take that shoulder, stretch it over. And over to the other side. And then back to, and roll it up. Walk the feet in. Place one foot to the front. Stretch it out. So instead of stretching down to the toes, stretch out. Grab my hand. Feel that stretch in your hamstrings. And bring it up. Switch legs. Stretch out. Great. Keep stretching. Grab my hand. And pull it up. We're gonna take a giant step forward. Drop that back knee slightly. Bring the hips forward. Stretching at the end. And the dynamic stretching, the warm up, the cool down are very important to the workout. Switch legs. Perfect. Perfect. Awesome. Bring it together. All right. Take a deep breath in. Exhale down. One more time. Deep breath in. Exhale down. Final time. Palms all the way up to the top. Bring them in. Draw it in to your heart. And thank you so very much for allowing me to be part of your workout.
Thank you for joining us today at the 17th Annual Health Expo, brought to you by the Center for Closing the Health Gap and Urban One Cincinnati. Now, let's give a very big thank you to all of our sponsors and partners: Cincinnati Children's, Fifth Third Bank, UC Health, Christ Hospital, Cincinnati Medical Association, Kroger, Procter & Gamble, U.S. Bank, Tri-Health, Radio 1, Local 12, WSTR 64, Cincinnati Herald, City of Cincinnati, Cincinnati Health Department, Cincinnati Children's, UC Health, Christ Hospital, Tri-Health, and Mercy Health. Thank you again for joining us for our virtual 17th Annual Health Expo, powered by the Health Gap.